now that we prepared our tooth or teeth, we're going to be using a triple tray or regular tray. In this case, watch the course on impression materials and trays to learn which one to use when. We're going to ask the patient to bite down. We make sure that this plastic doesn't get stuck on teeth when they bite. Plastic has to be behind the last tooth, and then the patient will bite down. And if we take a quick look, this is how it looks. And it wasn't like this where they cannot close. Okay, so when they bite like that, we're now going to be able to take the impression. So the way it works is we take our light body. Here we're using Genie light body, but you could use any material just as long as the light body and the heavy body, they have to be the same company. So we have a dispensing tip and a small tip that goes into the gums. And if you take a quick look, we're going to be bringing it out, and as it comes out, we want to squeeze interproximally first. Then without bringing it up, we're going to squeeze into those cheeks and out. And then we're going to do the same thing on the lingual. Okay, squeeze it like that. And in this case, we're going to do 2 for you, so you get to see right away. Same process, right? So this just tells us better detail of the material. Okay, and then I like to sometimes put it on the teeth next to where we need it. And once that happens, we're going to either on the tray leave a little bit or on our glove place a little bit for marking. The next thing is we're going to take our heavy body, okay, and we're going to squeeze it. Now, this is the top part. We don't need too much, okay? This is probably all we really need. But for the bottom part where we have the actual teeth, that's when you want a little bit more, because you want this material to compress down, okay? So now, again, once I'm done, I'll put a little bit here, or some people just put it on the tray, and we'll tell you in a moment why that's important. Then as I'm going in, I say open wide. Then we're going to put it in to make sure we're putting it in behind the last tooth. We then ask the patient, we put this in, please close down for us. And as they close, we want to make sure that they closed all the way. And right here you could see that the teeth all came close together. And now we would ask them to, we would have their cheek on top of this, okay? And at this point, sometimes their cheek would push everything in, but if it doesn't, and if I feel something is short, like in this case, I could just squeeze extra in. I could squeeze extra in, right? There's always a way out of this, but as long as the material doesn't harden. Now this process takes about 3 minutes, and we'll be back when it sets. So now to check, when we put our nails in, as you can see, it's already indented. This is firm, and over here on our hand, if we take a look, it's also firm. When I peel it, it could tear. If it tears, that means it's set. Same thing here with the light body. If it tears, that means it's set. However, if you check over here, it's still stringy, right? When it's stringy, that means it's not set yet. The good news is in the mouth there's warmth, so whatever we have here in the mouth will go faster. So basically we say, our patient, please snap open or gently open, and as they open, right, one side is going to open, and take a look how it looks. And then ready, we're going to pull it up. Second side will open. This is one side, the way it looks. And now this is how the other side looks. As you could see all around the material, the green settled over, and you could see the full margin of your prep. That's how you know you did a good job. If you didn't see the full margins, and it was, say, something like this, there was a drag in the material and it didn't pick up all the information, then it'd be no good. In here, it's all solid. The next step is to pour up this model. Send it to the lab. They'll pour it up and they'll use this to make a permanent crown.